Metro Manila mayors will meet to discuss the need to enforce unified and longer curfew hours amid the rising cases of COVID-19 in the region. Now let's talk to Interior Undersecretary Bernardo Florence Jr. He is the officer in charge of the Department of Interior and Local Government. Good morning, Yusek. Thanks for taking our call.
Yeah, good morning, Ria, and of course to our televiewers.
Sir, local government units have been intensifying their efforts to curb the spread of COVID-19. What other measures are you putting in place? And is there a plan to impose stricter border controls, especially between Metro Manila and its nearby provinces like Cavite, Bulacan, and Rizal?
Yeah, we are intensifying our implementation of minimum health standards, and that's why we directed our LGUs as well as our PNP to coordinate so that at the barangay level we can impose these minimum health standards. Very important is the coordination among law enforcement units and even the barangay tanods and our BERTs, our barangay health emergency response teams. No? What we did was to recommend to the Metro Manila Council through Mayor, the former Mayor Abalos, who is now the chairman of MMDA, to impose a uniform curfew hours, and that is from 10 to 5 o'clock in the morning. As it is, there are different time of implementation of curfew hours, not only here in Metro Manila, but even in the provinces. And that confuses the public.
Yes.
As you cross the border, there are different time implementation of the curfew. So we recommended a uniform or standard curfew hours. Not only that, we also recommended a uniform penalties for the imposition of some violations of our guidelines, Ria.
All right, sir, what's happening now are these granular lockdowns, and then, as you mentioned, the different curfew hours that are being imposed by LGUs. Do you think this is enough, or do you see the need to tighten quarantine status and protocols?
Yeah, they can impose a localized or granular lockdown in their respective areas without necessarily requesting the approval of the IATF nor the RIATF. They can do that within their respective areas now, but we augment them. Even our contact tracers. I directed the Philippine National Police to also augment our existing contact tracers so that we could deploy them in areas that are needed, Ria.
Yeah, this is something that was mentioned by Chairman Abalos when we spoke to him yesterday. He said, I think right now there's about 2,000 contact tracers, although at the height of it there was 10,000. How many are you planning to get, and where exactly would you deploy them?
Right now in NCR, we have 9,000, close to 9,200, 192, I think. But that is not enough, considering the fact that we have high incidents, or the cases here are increasing, starting last week. But I'm glad that yesterday it went down to just about 2,400 cases in a day. It used to be more than 3,000. Now I'm glad that Chairman Abalos is also helping us by hiring for the MMDA about 300 contact tracers more that could add to our existing contact tracing force in NCR. But we also augment them through our local police who are already trained in contact tracing, Ria.
Right, that is so crucial in controlling the pandemic. But sir, aside from Metro Manila, spikes in cases have also been recorded in several regions. So anong regions ang areas of concern, and how are the LGUs there addressing this?
The other areas of concern are CAR, dito sa Northern Luzon, and then yung Cebu City, and then Cebu Province. Yun yung mga areas of concern natin aside from Metro Manila. Nakikita natin yung cases dito tumataas. But as of yesterday, nakita natin na bumababa na because of our intensification and implementation of minimum health standards. The secret here really is at the barangay level. So we just have to enhance and intensify our efforts, Ria.
All right, thank you so much for your time this morning, sir. We appreciate it. DILG Officer in Charge, Bernardo Florence Jr.